Good afternoon and welcome to this afternoon's podcast, where I am joined by Jackie O'Reilly, who you'll have seen in a previous podcast on environmental health, and also today a first-time podcaster. I'm delighted to be joined by Louise Coid. Jackie and Louise both work in public protection for the council. The job titles are far more elongated than that, but suffice to say that they're both involved in public protection, and we'll try and cover a little bit of what they both do and what they're both involved with currently during this pandemic. Good afternoon, Jackie.
Good afternoon, Mike.
And good afternoon to you as well, Louise.
Hi, Mike.
Jackie, we'll start off with you. You know, people have been reading in the papers and hearing through the media about COVID marshals. We have received some funding, and we have employed people, but we don't actually call them marshals, do we? Could you sort of give us an overview of what we do call them and what we're actually doing?
That's correct, Mike. Thank you. We've employed 4 new members of staff using funding that has come from central government, and we've pooled our funding between contact tracing and business support. So our officers are called COVID technical officers, and they provide both support to businesses and doing compliance monitoring, but they are also involved in contact tracing. And what we felt was better for Copeland was to have officers that could undertake a range of duties rather than just concentrating on one area, because the funding didn't go so far. So we have pulled together all the funding, and the officers do part of both of those roles. The contact tracing role is extremely important at the moment with our rising cases. And what that involves is the officers working as part of the Cumbria locally enhanced contact tracing team, making contact with residents in Copeland who have tested positive. And the reason they make this call is to check that the person is aware of their results and that they understand what the isolation requirement is. What we'll also do is ask that person for details of where they work, because it is important to try and spot any trends or clusters that may be happening across our district area. And we also ask them for details of any of their close contacts. And a close contact is anyone that you may have been within 2 meters of for more than 15 minutes, or during the day, the time is accumulated up to 15 minutes. So we take the details of any of the close contacts, and then we also speak to them to make sure that they understand that they are required to self-isolate. The isolation is for 10 days, and the date of the isolation will vary from person to person because it's linked back with the date you're in contact with the person who has tested positive. And for those that have tested positive, the 10 days start from the date they started to show symptoms, or if they are one of the many people that there are that haven't showed symptoms but have been picked up by testing in the workplace or testing for other reasons, their 10 days will start from the date of their symptoms. And while we're talking to everyone, it is really helpful to understand where people work and any of those connections that might be happening there. But we are also able to check that for the time that they are self-isolating, they are fine for sort of sources of food and medication, because not everyone's support network may not be able to come out and provide them with food. So we have that option there. The team works 7 days a week doing that role. So if people get a call on a Saturday or a Sunday, don't be surprised about it. It is important that we make contact with people as soon as we can. If we're not able to get through to people on the phone, we do send emails, and we may also send a letter to their premises, because it really is important that we talk to all those people. So the team work on that, and then they also combine that with business support, and the two work well together, because if a person has mentioned a workplace, then they can use their skills in working with businesses to follow up and give that business support as well.
That's great, Jackie. That gives us a good overview there. Louise, you were heavily involved, well, not heavily involved, you actually led the setting up of the Copeland Hub in the police station at Whitehaven. That's something that's since been replicated in several other councils, certainly all over Cumbria and beyond. Could you just give a brief explanation of what the hub is, what its purpose was, why it was set up, and what it does?
Yes, so the hub facilitates the tackling of antisocial behaviour from a multi-agency perspective. It was long recognised that antisocial behaviour just isn't something that the police deal with or environmental health deal with, that we can all come together collaboratively to look at a problem in a coordinated way. So we facilitate that. So it could be something as simple as two neighbours that have a disagreement over something that may escalate into a referral to us, or it could be a wider community issue. So what we'll do is we'll look at all aspects of that and see what appropriate agencies can come together to tackle that problem. We have a wide number of agencies, the police, Copeland Borough Council, all the registered social housing providers, for example, Unity, and a lot of the third sector as well. So we all come together to have a look at a problem. We also deliver the action plan for the West Community Safety Partnership as well. So that is agreed. We look at all of our issues within West Cumbria, so that's Copeland and Allerdale, and how we can best address those. And also we can deliver some proactive projects. So last year we delivered the Copeland Community Alcohol Partnership Scheme, which was focused on the Egremont area, and that was tackling underage drinking. Unfortunately, because of the difficulty in delivering some of our projects, because some of our projects we deliver in schools, that we've had to put those on hold at the moment because of the COVID pandemic.
Okay, when we were off camera before we started today, you talked about when you joined the council 26 years ago, you got one job, and now you all get several. Your role extends into emergency planning. You know, we're pretty much in a state of emergency now, right across the country, you know, as well as in Copeland. What does being involved in emergency planning entail, Louise?
So yeah, that's right. It's been a very, very busy 10 months or so, because obviously we've been responding to the COVID pandemic. So what emergency planning and how it ties in really with the hub is that when you're delivering or responding to a major incident, again, it's partnership working, and all the partners come together to try and tackle what the incident is, whether it's flooding or the pandemic, for example. So for me, it's the building of working relationships that work, so that if I have to make a phone call at 2 o'clock in the morning under pressure to get someone out of bed to help with this incident, it's good if I already know who that person is on the other end of the phone. It makes it much, much easier to deal with. So it's really an extension of that role. And also we found with the partnership working, because we already have the foundations there, that it's been much easier for us to all come together in delivering the response to the COVID pandemic as well, especially around community tensions and information sharing between agencies as to where our problems are emerging within the communities, and also to help with the joint patrols that have been carried out with the police and our new COVID officers in going around businesses, etc., giving advice and engaging with those businesses.
Nice, Jackie. The marshals, you know, I'm guessing they are they. Well, I'm not guessing. I'm asking really. Are they the ones who give advice to businesses on do's and don'ts, what can and can't be done, and also do they link with the hub and the work that Louise is engaged with?
The COVID officers very much do link in with the hub, and we are regularly sharing information. If it's almost on a daily, if not more than that basis. The COVID officers have already done a range of joint patrols, and we do share information out between the two. And while they're there, but they don't always visit premises with the police. It is sometimes we are doing joint work with the police, and sometimes the COVID officers will be acting and visiting on their own. So it's joint work between the two, but it's really important to sort of follow up on any complaints that we have and to respond to any public concerns. So it can range from a question about should a business currently be open, or it can range to a business asking for how can they meet the current restriction requirements. And as we move towards the time when restrictions get lifted, because we're always focusing on what we're doing now, but we have to look into the future as well, we will give the same level of support to help businesses open up safely when the legislation and the law allows them to open. But it is regular joint work between environmental health and the COVID officers and Copeland Hub.
I'll ask you both the same question now. I'll come to you first, Louise. What's the biggest challenges this pandemic is throwing up, and what sort of appeal would you send out to the public in how they can help us to help them?
Oh, I'll just get off mute there. So there's two things that's coming out for us. One is mental health. The mental health of people. We're stuck indoors. It's January. It's dark. The weather isn't great, and we're being told to stay at home. And I fully appreciate the reasons why we're staying at home, and I'm staying at home. But then that does bring issues regards people's mental health. And I think what we are going to see emerging, if it hasn't already in some areas, is that the calls for service on our mental health services are going to be really, really stretched. And I do think that we need some funding to enhance our mental health services here in Cumbria to help tackle this, whether that's through a voluntary sector or through the NHS, etc. I do think that is going to emerge as an issue. And then the other issue for us that we've seen is the community tensions that are being caused in our small rural communities, where people are continuing to visit the Lake District. They still want to come here, and people are getting uptight about that because they're having to stay in, and they don't want visitors coming and bringing the COVID pandemic with them, which is how they see it. So there are some community tensions out there, especially regarding our visitors. And with Cumbria, we survive on tourism. It's our biggest business. So we don't want to be putting off the tourists to come to the area once we open up. But what we have to try and get across is a balanced message to say, yes, we're here, but we're closed at the moment. But we will be opening up as soon as this pandemic has been lifted and the restrictions are lifted. So please, can you come back just in a few months' time instead of now? And I think those two issues there, that once we start to come out of this pandemic might start to see issues emerging.
Good, Jackie. I listened to Colin Cox yesterday, and there was the beginnings of some encouraging noises that the trends may be starting to turn, and infection rates may be starting to peak or pass a peak.
Yes, the current figures are starting to show a small tailing off, but it isn't the time for anyone to relax. And so the advice I would give is stick to the requirements to keep your distance from people, wash your hands regularly, make sure there's enhanced cleaning of any contact surfaces, and to wear masks whenever you are required. And it really is that keep your distance from people. And every little thing that we can all do all contributes to helping that continued downward sort of trend of our infection rates. But the infection rates currently are much higher than they were in December. So we've all got to still sort of stay to be really, really careful. It's not the time to relax. But what we do see from our businesses and all of our public and visitors into the Copeland area is a very, very good compliance rate. And it is just a plea to continue that and to recognise that everybody is dealing with the effects. So within our service, everybody is dealing with the effects of that, and it's just to be kind to each other and remember that the rules apply to everybody. And one of the best bits of advice I've seen from different public health officers is to always act as if you could be infectious, and don't look for loopholes. If you're required to stay in, stay in. If you can work from home, work from home. But really, if you're out, keep your distance from people.
In terms of public access and the information on what's happening in terms of the pandemic, is that information readily available, or is there more that we could do as a local authority to make that information readily available to people?
Providing information, I think, is one of those areas where you can always do more. Every time you think you might have done enough, that's probably the time when you're not doing enough. So on Copeland's webpage, we do have COVID-related information, and it's focused and targeted at businesses, linking them through to the government's website so that all the information is current. What we do also have in Cumbria is, via the Health Protection Board, every Thursday there is a paper that is published on the Cumbria County Council's website, and I think we could do more to promote that. So that will be a new piece of information that goes onto our website, and to use our social media pages to alert people when it's publicly available information, but there is so much information out there that you can spend a lot of time looking for it. So we can put key parts of information on our website and social media pages, and listen to any other suggestions that anyone's got about any other ways we could help share information.
And Louise, finally, the approach to this pandemic, you've been around the council a long time, and within the leader management group, it's very much a joined up approach across all departments to addressing some of the issues that we've got.
Yes, it is. I mean, it's Cumbria wide. When we're dealing with an incident, a major incident in Cumbria, say flooding, for example, we have the mechanism in place where we bring all the appropriate agencies together, generally chaired by the police, and exactly the same here. This is a major incident. It's a lot longer than a flooding incident. It's taken many months, but it's exactly the same process. We're all coming together. So we have the Cumbria-wide team that are looking at the Cumbria response, but also we've got our Copeland team as well that are looking at Copeland, and we all feed into each other. It's two-way, up and down, and yeah, that's how we deal with these types of incidents in Cumbria.
Okay, Jackie, thank you very much for joining me once again today, and you as well, Louise. Really appreciate you both taking the time. Very, very informative, and all this really does help our residents get a full understanding of everything that's going on and everything that we're endeavouring to do to try and support them. Thank you both very much.
Thanks.